Heat can harm you. Heat illness. Your body's way of letting you know it's too hot and can't cool down. Just as a machine can overheat and break down after working too hard for too long, so can your body. This video explains what causes heat illness, what you can do to prevent it, the different types of heat illness, and the signs to watch for in yourself and others, and what to do if someone gets ill from the heat. When you work, your body produces heat that can make you feel uncomfortable and threaten your health. The harder you work, the faster you build up body heat that affects your physical and mental abilities if it isn't released. Your body cools itself in a few ways. The fastest is by sweating, which takes water from your bloodstream. If you don't replace that water by drinking, you can get dehydrated, lose the ability to cool down, and suffer other symptoms. No matter where you are working or what you are doing, driving a tractor, harvesting grapes in the sun, or loading trucks in a shipping yard, heat illness can strike you before you even realize it. Many things, both environmental and personal, increase the risk of heat illness. You need to be alert to both kinds of risk factors. Environmental risk factors for heat illness include warm or hot air temperature, high humidity, working hard for extended periods, heat from the sun and other sources, lack of air movement, and clothing and personal protective equipment that makes it harder for the body to cool. Personal risk factors for heat illness includes one's age, how you are acclimated, that is, the extent to which your body has already adjusted to working in the heat, health, consumption of water, alcohol and caffeine, and the use of medication that affects water retention or how the body responds to heat. These are among the factors that affect your ability to cope with heat. For example, the harmful effects of heat on the body generally increase as we age, so older employees especially need to be aware of how they are reacting to working in the heat. Persons who are overweight or in poor health are also at greater risk of heat illness than are others. But even so, heat illness can strike anyone, no matter one's age or physical condition. A young, robust worker must also be careful not to push himself too hard when working in conditions posing a high risk of heat illness. Reducing heat buildup. As you go about your work, there are a few simple things that you can do that will help you cope with the demands of working outdoors in warm, hot, or humid weather. When you feel you need to, take a few minutes to rest or work slower to let your body's cool-down process catch up and cope with its production of heat. When possible, take your rest breaks in the shade, where the air is cooler or where it is breezy. If you take your break inside a vehicle, make sure it's air-conditioned. On a warm or hot day, it's probably hotter inside a vehicle without air conditioning than it is outside. Rest breaks are also a time to replace body fluids by drinking water. Even as you work, make it a habit to drink at least 1 cup of water a few times each hour if you are sweating. Your clothes affect both your exposure to the sun rays and the rate at which heat leaves your body. When working under the sun, wear lightweight, loose-fitting clothing that is light in color and made of a breathable, absorbent fabric such as cotton, long sleeves to prevent sunburn, and a wide-brimmed hat to protect your head and shade your eyes when working under the sun. Medication and other drugs may interfere with your body's ability to cope with heat. Certain over-the-counter medicines and prescription medications may increase your risk of illness by reducing your body's ability to deal with heat. The same is true of certain commonly consumed drugs, such as alcohol, which is in beer, wine, and liquor, and caffeine, which is often in coffee and soft drinks. Other medications can hinder your ability to recognize symptoms of heat illness. Ask your doctor or pharmacist about how your medicine might affect you while working in the heat. Take time to get used to hot weather. Many heat-related illnesses result from working too hard too soon after starting to work in the heat. Your body needs time to adjust to working in the heat, so take it easy for the first week or two doing a job in hot conditions, or when returning to work in the heat after several days off. It can take up to 14 days for your body to fully adjust or acclimate to changes in temperature or working conditions. In some cases, your supervisor might be able to start you with a shortened workday and increase your hours up to normal after 1 or 2 weeks. Gradually increasing your daily working time will allow your body to adjust to doing strenuous work in warmer weather. Sweating releases heat. Sweating is the fastest way your body releases excess heat. Because sweating takes water from your body, it is important to drink fluids regularly to remain hydrated and prevent heat illness. When working hard in the heat, most people need to drink about 4 cups of water per hour to replace what they lose in sweat. Drinking small amounts of fluid frequently is much better for you than drinking a lot all at once, such as only at lunch or at the end of the day. Thirst is not a timely indicator of your need for water. By the time you are thirsty, your body has already lost a lot of water and you are already dehydrating. Your employer provides you with clean, cool, and safe drinking water and wants you to take advantage of it. Make sure you know where the closest water station is. If you're unsure, ask your supervisor. Don't be fooled by advertisements claiming sodas and beer cool you off and quench your thirst. Drinks containing caffeine and alcohol stimulate urination, so they do not replace the fluids you lose when sweating. The bubbles in all carbonated beverages, soda as well as beer, tend to make you feel full before you have drunk enough. And drinks with sugar, even juices, can be slow to enter the bloodstream, cause bloating, and endanger diabetics. Water is generally best to replace fluid lost as sweat. Responding to symptoms. If you are ever faced with a health crisis at work, you should always follow your employer's plan for handling emergencies and know how to get medical aid to the worksite. These procedures tell you how to contact emergency medical services, how to direct emergency personnel to your worksite, and who to contact within your company in an emergency. When working in extremely rural or hard-to-find locations, getting quick medical attention may require transporting your coworker to a predetermined place where emergency medical personnel can easily meet you. If you are unsure of your employer's plan for getting medical attention for yourself or a coworker, ask your supervisor and make sure you understand what to do in a medical emergency. Symptoms of heat illness may appear very quickly. If ignored or not recognized, they can get worse, require hospitalization, and even cause death. Watch for the early signs of heat stress: loss of strength, stamina, coordination, and concentration. You may also begin to feel nauseous or lightheaded, experience headache, blurry vision, and dizziness. If left untreated, the body's condition can worsen, and cramping, fainting, and even stroke and seizures can occur. In many cases, serious heat illness strikes so rapidly that the normal pattern of symptoms is not visible and is not recognized that heat illness is occurring until it is too late. Because of this, it is important to always be alert for signs of heat stress, report the situation to your supervisor, and respond to any signs or symptoms of heat illness immediately. There are different types of heat illness, each with different symptoms. Heat rash, also known as prickly heat, is a skin irritation caused by excessive sweating during hot, humid weather. The rash looks like a red cluster of pimples or small blisters and often occurs in the neck, chest, or in elbow creases. Heat cramps are caused by dehydration and loss of salt due to sweating. Painful muscle spasms begin in the stomach, arms, legs, and other body parts. Fainting, or heat syncope, a mild form of heat illness, is the result of dehydration and lack of adequate blood supply to the brain. Symptoms include faintness, dizziness, headache, increased pulse rate, restlessness, nausea, vomiting, and possibly a brief loss of consciousness. Heat exhaustion is the result of excessive dehydration. Signs of heat exhaustion include fatigue, headache, chills, cramping, fast breathing or pulse, pale or clammy skin, nausea, dizziness, and extreme weakness. The most extreme form of heat illness is heat stroke, a life-threatening emergency. Warning signs of heat stroke include confusion, dizziness, nausea, throbbing headache, red, hot, and dry skin, rapid pulse, muscle spasms, loss of consciousness, and coma. If you experience any of these symptoms or notice them in a coworker, immediately contact your supervisor and begin the cooling process. Get the affected person into the shade and remove heavy clothing, socks, and shoes. Fan the victim with a piece of cardboard, a newspaper, or anything else that will move air. Sponge the face and neck with cool water. Ask the person, if conscious, to drink small amounts of water. In extreme cases where a person has fainted or is otherwise unconscious, do not try to give the person water. Just do your best to cool the person and lower his or her body temperature in any way possible, such as by laying the person in a creek, stream, or other cool body of water, or using a hose to spray water on the person. Quick thinking, common sense, and watching for the symptoms of heat illness can help keep everyone on your crew safe and healthy. In summary, remember these points before and while you work in a hot or humid outdoor environment. Where possible, get used to working in hot weather by working for short periods at first, and then working longer periods as you get used to the heat. Drink lots of water, even if you are not thirsty. Avoid beverages containing alcohol or caffeine, such as beer, soft drinks, and coffee. Ask your doctor or pharmacist how medication you are taking will affect your ability to work in the heat. If you are elderly, overweight, or are in poor health, be especially careful when working in hot or humid conditions. Wear lightweight, loose-fitting, light-colored breathable clothing like cotton and a wide-brimmed hat. Rest when you feel you should, in the shade, where the air is cooler or where it is breezy if possible. Know the signs of heat stress and watch for them in yourself and coworkers. Know your employer's procedures for getting emergency medical assistance. Again, your employer wants you to remain healthy and safe. Remember to work safely, every day, every shift.